The word psychedelics often conjures up images of the hippie movement, an era of free love, amazing music, and mind-altering drugs. Well, it turns out that those mind-altering drugs can actually be beneficial in treating trauma, depression, PTSD, severe anxiety, and other mental illnesses. The University of Pikeville has recently joined the University Psychedelic Education Program, a groundbreaking national initiative focused on training faculty to incorporate evidence-based, culturally responsive content about psychedelic-assisted therapy into the curriculum. We spoke with Dr. Janessa Kilgore-Bowling to learn more.
So when we say psychedelics, what are we talking about?
So when we talk about psychedelics, I think most people think about the recreational use of, like, they think about the 70s and they think about magic mushrooms and LSD, and that is definitely included in the process. But we're talking about something a little bit different. This is a therapeutic use of psychedelics, or of plant medicine. I think it's more appropriately called when we're in this kind of setting with it.
Are there certain psychedelics that people are familiar with that can be applied in this realm?
I think in our area, I think people are probably most familiar with ketamine. Most people are familiar with psilocybin, which comes from the mushrooms. They're familiar with LSD, MDMA, ayahuasca, things like that.
All right, so a lot of people associate psychedelics with that hippie movement.
Yes.
And, there's varying views on that, some stigma attached to, what that represented.
Sure.
Do you see that stigma being an issue?
I think it is, just because we don't understand it. Prior to it being listed as a Schedule 1, it was being researched as far back as the 20s. Oh, wow. And we were finding medical uses for it then. There was the whole war on drugs, and all of that. So I think there is a stigma attached to it for that reason. However, this plant medicine is being used to treat mental illness, which is also very stigmatized. So I think there's a lot of stigma that we have to overcome, but it's not impossible. And the key, I think, is education.
So this is it's a college-based program right now, but do you foresee it kind of like spanning out or spreading out into the community and like healthcare providers in Pikeville surrounding area practicing?
I do. So we do have a few agencies locally that administer ketamine. Our goal of being part of this is that we want to do some continuing education, and we want to be able to talk about, what are you doing in your agencies? What is best practice? How can we support you in, reaching that best practice? I personally believe that it will absolutely change the landscape of mental health treatment in Appalachia. Well, across the nation, across the world, but I'm really excited about what it could do in Appalachia for sure.
Reporting for Mountaintop News, I'm Robin Tillman.